Hello, hello. Good morning. Thanks for joining me this Monday morning again in my series of things to expect or questions to respond to if you or your loved one has cataract surgery planned. I'm Dr. Mitra, your ophthalmologist in Northern California with locations in Roseville and Grass Valley. And today, with this lovely background, I'm in my Grass Valley location getting ready for a clinic full of patients today. So I might even be seeing you. Um, so I, we've kind of started a process. I wanted to address some of the most commonly asked questions. Today is going to be, what happens in preparation for the day of surgery and partially what happens day of surgery. So about 2 days prior to the date, you are going to start on some eye drops that your eye doctor has prescribed for you. Some of them, it would be a combination of antibiotic and anti-inflammatory. It's essentially to prepare your eye to minimize inflammation and minimize possibility of infection before you get to the surgery center. You will also receive a phone call from the nurses at the ASC, and they will confirm the exact time of arrival for surgery. Because my scheduler gives you when my scheduler gives you the date of surgery, the time is to be assigned. So when the nurses call you, they will confirm the time of arrival. They'll review your list of medications, your allergies, make sure that nothing has been left untouched. And then, of course, as far as, list of medications, they'll probably let you know that the blood pressure medication, if you take them in the morning normally, you want to still take it on the day of surgery with a sip of water. Diabetic medication and also blood thinners are things that you will discuss. The diabetic medication, depending on whether it's long acting or short acting, and also depending on the timing of your surgery, that's something that you will discuss with a nurse from the surgery center. Blood thinners, everybody has a different protocol, but I tend to cataract surgery is supposed to be a bloodless surgery. I tend to keep my patients on their blood thinners because I feel like the risk of being off of it is far greater um, than being on it during surgery. And again, this is dependent on your eye surgeon, and this is my method at this time, so that may change. You will also be given instructions to have nothing to eat or drink by mouth after midnight. This is excluding the sip of water that you're going to take your medication, your blood pressure medication in the morning. So at this point, you will have arranged a ride, somebody to take you to the surgery center and bring you back, because you are not going to be in a position to drive yourself back, and we wouldn't go through with the surgery if you didn't have a ride. As far as clothing, you want to make sure that your clothing is loose and comfortable. So nothing with perhaps something elastic as far as your pants are concerned, nothing with snaps or zippers. It's just a lot easier day of surgery, and certainly since you're going to be laying on a eye bed, you are going to be more comfortable yourself. So then the next step is getting a good night's sleep. Now that's easier said than done because, of course, if this is your first eye, you are going to be nervous, and that's normal to be anxious about it. It's important for you to just try and get as much rest as possible. And even if you are missing some of that sleep, you'll make up for it the day after surgery because of the IV sedation that you have. You're probably going to get the best naps and the most restful sleep the night after. Day of surgery. So you want to get to the surgery center in plenty of time. You make sure that you take your insurance cards with you. They may want to review that. During the time of COVID, you may want to take your vaccination card with you. And of course, every center has a different policy. Some of the centers I operate at require COVID testing, and some require your vaccination card. And of course, checking your temperature when you arrive. So you essentially check in. They're going to give you a little wristband with your name, date of birth, all that good stuff. One of the nurses will take you to the holding unit, and there they may have you change into a patient gown and start an IV on you. So once they start an IV, you're going to be laying on your bed in preparation for the surgery. The nurses will put a sticker above the eye that we're working on. Of course, before that, they're going to ask you a million times, so will I, which eye are we operating on and exactly what are we doing? So I don't want you to get nervous. We do know which eye we're going to be operating on, but sometimes it's just a matter of making sure these safety measures in place to make sure everybody's on the same page. So then they start the dilating drops in that eye, and there may be a set of 3 or 4. It depends on how easily your pupil dilates, so that eye will have good access to the back of your eyes. As you're laying there, the anesthesiologist or your CRNA, who's a nurse anesthetist, depending on the surgery center that you're at, will come to you and talk to you about IV sedation. So you will get just a touch of medication through your IV. It's not going to be as deep as what you may be used to when you have colonoscopy, in that you are going to get enough medicine to make you comfortable, to make you not be anxious, and as I describe it to patients, to not care what's going on. And yet you're not asleep, and you're able to follow instructions so that I can let you know what's going to happen every single step before it happens, prior to it's happening. So nothing will be a surprise. Then I will come by, we will go over again what eye are we operating on, review the type of lens that we decided on our final discussion, make sure there haven't been any changes, make sure that I review, you still want your vision to be at near or far, and then and answer any questions that you might have at that point. So this is basically, and then we roll to the operating room. So I think the next video will be what my patients tell me they expected or they saw once they were in the operating room on the gurney getting ready for surgery. I think that will be our next video. If you have any questions, please let me know in the comments once this video is posted. And of course, if you or a family member wants to have a consultation with me, you're more than welcome to visit my website, mitramd.com. I encourage you to share and like my Facebook page, which is under capital I Medical Group, and also my Instagram, which is Mitra MD3. That way you get alerts as far as the next videos, or sometimes you can post your questions or PM or DM me, and we can answer some of those questions for you. I think that's about it. I look forward to taking care of you and your family members. I love to provide my patients with the best potential vision possible so they can live life fully and enjoy their hobbies for years to come. Thank you so much. Thank you so much for joining me on this Facebook Live. I appreciate it. See you on the next one.